The National Health Insurance Fund has denied allegations that the fund owes hospitals 25 billion shillings in claims. This comes as the Rural Private Hospital Association of Kenya claims that the fund owes private and mission hospitals 15 billion shillings and government hospitals 10 billion shillings. The fund's CEO, Elijah Wachira, was also quick to dispel accusations that the fund was not only on its deathbed, but dead. Helen Aura reports.
The ongoing transition from the National Health Insurance Fund to the Social Health Insurance Fund seems to have been met with the bittersweet reactions from key stakeholders. The Rural Private Hospital Association of Kenya, RUPA, says NHIF is walking dead.
The cause of death of NHIF is three things. Number one, the removal of the teachers' medical scheme from NHIF resulted in a loss of over 17 billion per annum of revenues to NHIF. Number two, the removal of the police medical scheme from NHIF. That one alone cost the NHIF 8 billion shillings per annum. So cumulatively, NHIF has been bleeding 25 billion shillings per annum from its revenues. Number three, misappropriation of revenues by consecutive NHIF boards and administration.
A claim that the fund CEO Elijah Wachira has refuted.
Each scheme finances itself when it comes here. We price schemes in such a way that we shall be able to settle all their claims and provide for management expenses. We do not have, or we are not in a situation where our assets are less than obligations, and that statement is not accurate.
On their part, RUPA says it issued NHIF with a notice on the 8th of December 2023 to pay all pending debts. The national health insurer has not yet kept its end of the deal.
To protect the citizens of this country and to ensure that healthcare services will continue without disruption, we today announced that for NHIF beneficiaries, NHIF cardholders, up to 60% of services will be on a cash basis. All hospitals will charge a fee of Kenya shillings 1,000 for outpatient care. Admissions, surgeries, maternity care, cancer care, dialysis will also be subject to cash payment on a case-by-case basis.
RUPA has also accused NHIF of fraud, claiming that 60% of the payments go to only 100 private hospitals, while there are more than 8,000 hospitals in the NHIF database.
1st July to date, for capitation only, this is outpatient, I have paid 1.4 billion to government facilities, 1.8 billion to private facilities, and 800 million to mission facilities. 1.8 out of 5 million is definitely not 60%. It is 45%.
RUPA now wants NHIF to fast-track the payments to facilities, saying it has now been 3 months without payments. On their part, NHIF says it will facilitate a smooth transition into the new fund. Helen Aura, NTV.